Case-based learning is an opportunity for students to develop their clinical reasoning skills by working through a real patient case with a medical facilitator. So they start with what would actually happen. The patient comes into the emergency department or the general practice and says, I've got problem X. And then you take the history, you get the tests you need, you examine the patient, you get the results. So you're working through the problem just like you would as an intern.
With the CBLs, we expose gaps in the student knowledge, and they are able to fill those gaps directly with the tutor.
The benefits of the CBL was that we had just so much one-on-one contact with the clinicians.
Having an expert tutor allows us to ask questions and gain a greater insight into the case material than we otherwise would.
And the tutor/facilitator is somebody who's medically trained, somebody who sees these cases on a day-to-day basis.
Having the time to sit with an expert specialist for an hour and a half in a small group is really invaluable, and I learnt so much in that short period of time that it was probably the most effective learning I would do in my week.
The best thing about the patient cases are that they're real cases, so they're written by clinicians, but they're not actually written, they're taken from real-world cases.
So the patient cases in CBLs were really interesting. I found that they made you consider aspects of care that we maybe hadn't previously. For example, one of the cases was based around a prison inmate, so the case really challenged us to consider aspects of her care from the prison environment.
And you'd think about the patient as a whole and the family members that might be involved, the community aspects and other sort of issues that until you've had some clinical experience you wouldn't have probably had to take into consideration. So that was really fantastic.
So what we have are authentic cases, and we're asking the students to try and work through that problem, and then to try and look at investigations that will work through the differentials to narrow it, and then finally to look at management.
And they love that problem-solving aspect and being the inspector that has to go through and put together all the clues and put together the history examination, investigations, and come up with the problem list.
Each CBL session would end with, obviously we'd arrive at a diagnosis and go through a management plan, which we often looked at sort of how to modify other risk factors that they might have. And then often there'd be a follow-up as well in terms of what the patient's theoretical outcome was, say 2 years down the track or 5 years down the track.
You won't be left on a cliffhanger. You will be told exactly what happens to the patient at the end of the case in the short term and then again in the long term.
I really find CBL to be a very enjoyable teaching format. It allows for much more engagement with the students and working through the cases in a logical format as it would be in a real life situation.
I like watching people learn and get excited about absorbing information and putting the puzzle together. And it's also a really good opportunity to impart your clinical knowledge and experience, because you can't get clinical experience out of a textbook.